Are you aware of the warning signs of prostate cancer? Coming up, we will discuss 7 warning signs, and later on in the video, we will review various methods for diagnosing prostate cancer. This serious disease affects many adult men worldwide. Its silent progression makes it a formidable adversary, and the key to a successful fight lies in early detection. Understanding the warning signs is not just crucial, it's a potential lifesaver. First on our list is urinary problems. This could manifest as difficulty in starting or stopping urination, or frequent urges to urinate, particularly at night. Experiencing a weak or interrupted flow of urine or painful or burning urination could also be indicative of a potential issue. It's important to note that while these symptoms could be caused by less serious conditions, they are also common early signs of prostate cancer. If you're experiencing these issues, it could be a sign that you need to get checked. Secondly, you may notice blood in your urine. This can be alarming, and it's important not to brush it off. While it could signify various health conditions, it's also a potential warning sign of prostate cancer. It might be subtle, with urine appearing slightly pink, or more obvious with a darker, rust-colored hue. But either way, it's not something to ignore. Remember, any unusual changes to your urine should prompt a visit to your healthcare provider. Next up, we have 2 interconnected signs: erectile dysfunction and pain in the pelvic area. Now, erectile dysfunction is a condition that can be caused by various factors, but it's also a possible warning sign of prostate cancer. When the prostate is affected by cancerous cells, it can interfere with the nerves responsible for erections, leading to this issue. On the other hand, pain in the pelvic area is another significant symptom. This discomfort can arise due to the growth of the cancerous cells in the prostate, causing it to swell and press against the pelvis. It's worth noting that these 2 symptoms can be interconnected. For instance, persistent pelvic pain could lead to anxiety, which in turn could contribute to erectile dysfunction. Remember, these symptoms might not always mean you have prostate cancer, but they certainly warrant a conversation with your healthcare provider. It's crucial to communicate with your doctor about any pain or changes in sexual function. Moving on to our 5th and 6th signs: bone pain and unexplained weight loss and fatigue. Prostate cancer can sometimes venture beyond its original site and invade your bones. This unfortunate progression can result in discomfort or pain in your bones, particularly in the lower back, hips, or thighs. It's not merely an ache from a long day or a workout, but a persistent pain that doesn't seem to ease with rest. Now let's talk about weight loss and fatigue. As with many other illnesses, prostate cancer can cause a general sense of tiredness that doesn't seem to go away with sleep. This can be coupled with an unexpected drop in weight that isn't linked to changes in diet or exercise. It's your body's way of telling you something isn't quite right. These signs can often be overlooked, so it's essential to pay attention to your body and notice any changes. Before we get into the rest of the video, consider subscribing to our channel, as it encourages us to continue making helpful videos. Also remember to stick around for the ways prostate cancer can be diagnosed. Now let's continue. Our 7th warning sign is changes in bowel habits. Prostate cancer, in its advanced stages, may spread to nearby organs, impacting their normal functioning. This could potentially lead to noticeable changes in bowel habits, such as either constipation or diarrhea. You might also experience discomfort, bloating, or even changes in the appearance of your stool. Remember, these changes may not always be due to cancer. However, any persistent change in bowel habits warrants a discussion with your doctor. Now that we've covered the warning signs, let's discuss how prostate cancer can be diagnosed. There are various methods healthcare providers use to detect this disease. One common approach is the prostate-specific antigen, or PSA, blood test. This test measures the level of PSA in the blood. Elevated levels may indicate prostate cancer, but it's not definitive. Other factors, such as an enlarged or inflamed prostate, can also cause PSA levels to rise. Another method is the digital rectal examination, commonly referred to as DRE. During this examination, a healthcare provider uses a gloved and lubricated finger to check the prostate for any irregularities. While not as detailed as other tests, a DRE can sometimes detect problems that aren't picked up in blood tests. Finally, a biopsy may be done. This involves taking small samples of the prostate to examine under a microscope. It's the most definitive method for diagnosing prostate cancer, but it's usually done if other tests suggest its presence. To summarize the key points we've discussed in this video, the warning signs of prostate cancer can include urinary problems, blood in urine, erectile dysfunction, pain in the pelvic area, bone pain, weight loss and fatigue, and changes in bowel habits. If you experience any of these symptoms, it's crucial to consult with your healthcare provider. Remember, these symptoms can also be caused by conditions other than prostate cancer, but it's always better to be safe and get checked. Prostate cancer is a serious disease, but with early detection and proper treatment, it can be managed effectively. Early diagnosis is key, and being aware of the warning signs can help you take action early. Prostate cancer may be daunting, but remember, you're not alone in this. Medical advancements are ongoing, and many people lead healthy lives after diagnosis and treatment. Stay informed, stay proactive, and stay healthy. And as always, take care until next video.